So I'm joined by Dr. Jackall, who's a GP from Stoke-on-Trent, who's been using Attend Anywhere for a number of years. Jack, one of the challenges we have with working virtually is how do we support the MDT around us, particularly when people have got, say, a practice nurse or an advanced practitioner or a paramedic practitioner based in the surgery, or no, not based in the surgery because we're working virtually. Is there any way to use Attend Anywhere to give that supervision, review a patient and give them the level of support we would if we were working face to face?
Yes, so we've started using that initially really as a teaching sort of service, as a teaching experiment. So we have a range of medical students to physician associate trainees to GP trainees, and we can often do, if you like, it's either shared surgeries or independent surgeries. And we used to do video surgeries, but they sort of seem to have died out in terms of popularity. But actually, one of the things we can do now is we can stream. So we've had a couple of sort of sessions where using Attend Anywhere, we've been streamed with a patient consent. We've streamed the consultation to my room whilst the student and the patient are in another room. So you kind of remove that physical presence, but also it's a halfway house between totally independent and having a complete shared surgery. And that was quite interesting because the temptation for the student, whilst you're physically there and the patient, is to turn around and go, what do you think? And actually it kind of defeats the purpose of the object, saying, well, it's, you know, you're letting the reins kind of go completely, but at the same time you've got an emergency control, which is you can keep a close eye on that. The other thing again is around the MDTs that are planned, we can get a group of students in another room, mute, but actually have a ringside seat and have a bit of sort of guidance around exactly what's going on and what the issues are. So you can get firsthand. And in my attempt to encourage colleagues to emulate, and I stress it's emulating what I do as opposed to necessarily being the font of all knowledge and knowing exactly how to do it, is the gain that they can emulate what I'm doing and why I'm doing. They can sort of dial in, and they don't have to be physically there. So in the old days, I used to have trainees saying, okay, I'm going off to the MTT now, come on, finish your clinic. And they're like, I've still got 2 patients to see, I'm late, they're late, or I go and they don't get a chance to come. Instead now, it doesn't matter where they are. When they're ready, they just dial into the MDT and they can observe what's going on and they can start experiencing what goes on in MDT and start getting some getting some education and knowledge from that. So again, we're using that in a slightly different way in terms of augmenting experience, knowledge, teaching in terms of that.
That sounds great. And then what about if I'm seeing a patient, but I just want to sense check or show something to another colleague? Is there a way I can do that?
Yeah, so I had a case recently, a case in point where I'd seen a patient was had a slightly sort of odd sort of neurological presentation, and I messaged a colleague who wasn't on site saying, look, would you mind just jumping into the video consultation and let me know what you think? And I sent him a link, and within minutes he was in the room and we were both talking the case over with the patient there and repeating the neurological examination. And there are a number of times where I'll message my excellent sort of first contact physio, and I will either ask him for his opinion or his thoughts, or actually there's many times where I just sort of be the student, and I'll just sort of sit back and watch the assessment and learn a bit more about musculoskeletal, care. So it's about that flexibility to understand that we can either lead or we can either sort of pull back slightly, and it's about bringing in people that are best suited for that person at that point in time. So that's really important.
And then I guess as well, you've also got that capability for, so in places I've worked, we've had a number of adult residential homes, young adults, things like Down syndrome. Actually, you can have the consultation with them and the carer there, but link into a parent or another relative on another site to discuss care plans.
Yes, and we're planning to, so prior to this, we're sort of working up towards a primary care network offering where the district nurses, so how many times have we been called out on a visit where district nurse has been out and said, oh, your legs look like infected, they're red, you're taking a temperature, oh, call the GP out. At that point in time, we've given the link, and basically the district nurses can come straight in. So remember that waiting room. So wanted to create a room where the district nursing team, a professional team, can come straight through on the link, and they can basically ask for an opinion. You can say they can currently do this now, but often the professionals will say, we have to speak to your receptionist, and then, you know, we're holding on to the line and it's like 10 minutes, we've got another call to make, and then
Yeah, it's
you're in
easier
the
for them just to say they need a visit.
yeah,
We can't argue with that, and off we go. But actually offering that instant access, although it feels a bit scary and like it will open the floodgates, it
yeah.
can be a much better way of managing the demand that is coming in our direction anyway.
Yes, we've seen our visits. We've seen our visits. So in the same way with care home service, we've seen our visits, you know, go to a fraction, literally a fraction of what they were a couple of years ago, and there's a massive gain. So I think there are much more to gain than the risk of kind of losing or increasing in terms of our burden.
Thank you.